One. Okay, so today we are discussing Lyme disease for today's Focus on Health, and that's where Dr. Quinn joins us. Lyme disease is an infection that happens when an infected tick bites a human. It causes a rash, and often it's in a bullseye pattern. All right, thank you so much, Dr. Quinn, for joining us as always. So tell us, how is Lyme disease transmitted, and what are the symptoms to watch out for?
Well, basically, as you said, Lyme disease is an infection where an individual is bitten by a tick. The tick does not cause the Lyme disease. The tick acts as a vector, which carries the actual bacteria that's injected into the skin through the tick's bite. That individual can develop symptoms such as rash, headache, fever, fatigue. Some may develop confusion. In that case, it's best to take your person or yourself to a medical provider to be evaluated, and the medical provider will ask history. And if you have a history of noticing a tick on your skin and you develop what's the typical rash, which is the bullseye rash, where there's central clearing of the rash, then we have a high index of suspicion and we'll prescribe the antibiotic that can really be helpful.
But not everybody will always get the bullseye rash, right?
That is correct. So the research is citing that only 80% will get that rash, but the history can be made just based on the symptoms alone and the history of a tick. But in a lot of cases, note that the tick might not even be noticed because ticks can be very small, and maybe the tick will be on you and it can bite you and transmit the disease, but it has to be there for at least 4 or more hours. And the tick might fall off and you never even knew you were bit, because in the saliva of the tick, when it bites you, there's some numbing chemicals where you might not feel it. And you might have Lyme disease and not realize it. That's why in our segment, we advise anybody, if they're having any symptoms that are unusual, don't hesitate to call your medical provider and maybe discuss your symptoms on the phone with the nurse. And if it's significant, the nurse might ask you to come in and be evaluated.
Okay, so symptoms, we talked about symptoms. Now let's talk about those treatment options.
Right. So if you have the diagnosis of Lyme disease, there is testing, but these tests are antibody tests, which take 4 weeks to become positive. So if they test you for the antibodies through your blood, if it's early on in the course, it'll be a false negative, meaning you could have it, but the antibodies haven't formed yet. It takes about 4 to 6 weeks for your body to form the antibodies to get a positive test. So usually most medical providers, such as myself, we hold off on the antibody testing, which is very unreliable unless you've had it for 6 weeks or 4 to 6 weeks, but what we'll do is we'll just go ahead and treat what's called prophylactically, where we'll go ahead and prescribe the antibody. The antibody is doxycycline, and it's usually a 10-day course. And if you start it early, there's a higher chance that it won't progress and get worse. But then some people, they'll resolve it themselves just using their own immune system. So you don't necessarily have to be treated, but if you're not treated, you are at risk of having the long-term joint pain and possible neurological problems as well.
All right, some ways to reduce contracting Lyme disease is when you're outdoors is to wear long sleeves, long pants, and wear insect repellent, especially with the active ingredient of DEI, or DEET, excuse me.
Right.
But yeah, thank you so much, Dr. Quinn, for joining us as always. We appreciate your time. 12 News is back after the break.
Thank you.